Hi guys, good afternoon everyone. This is Dr. Bhupesh once again for you all from Dr. BKM Institutes. I hope I am audible to everyone, both online as well as to offline students. I hope I am audible. So I'm just gonna start this session first of all regarding how to do the reading part A. So reading part A, today we have got this reading part A thanks to the institute which has created this question paper. Again, Dr. BKM primarily deals in how to do the task. Again, no matter what kind of question paper it is, who is creating the question paper, it doesn't make a difference. The thing that makes a difference is the right approach. Again, guys, means every time I record, every time I say that most of the students will say, let's start from question number 8. No, start from question number 1. Start from question number 1. First important strategy to do reading part A in 15 minutes is to start from question number 1 to 7. Don't start from question number 8. First thing. I will tell you the reason while recording this session. But again, her recording में again that same example I gave you will ask me 1,000 times सन कहां से आता है आई विल से ईस्ट से आता है सन राइजेस इन द ईस्ट सेट्स इन द वेस्ट इन द सेम वे रीडिंग के फंडामेंटल्स हमेशा सेम रहेंगे चाहे मैं 10 साल बाद करूं दिस इज द बेस्ट मेथड ऑफ डूइंग रीडिंग पार्ट ए ओनली इजी क्वेश्चंस फर्स्ट एंड स्टार्टिंग फ्रॉम क्वेश्चन नंबर 1 मैं आपको दोनों के लॉजिक्स दूंगा I will give you the rationality of both the things. Again, thanks to the institute which has created the question paper. But let's do the question first. Okay, question number 1 to 7. फर्स्ट ऑफ ऑल रीड क्वेश्चन नंबर 1 to 7. आप मेरे साथ स्क्रीन पे रहो, आपको विजिबल है, आप पेपर मत हिलाओ, ऑफलाइन प्लीज मेरा ध्यान हटेगा. सो या क्वेश्चन नंबर 1 to 7 मेरे साथ ही चलो, आपको सबको विजिबल भी रहेगा. सो आई विल टेक अ पेंसिल विच आई एम नॉट क्वाइट श्योर वुड कम फ्रॉम हियर. या ओके कूल, आई एम टेकिंग दिस ड्रॉअर. So question number 1 says TAVI is performed in people with aortic wall stenosis. Okay. So I just carry the keywords for myself. Keywords आपको लेके चलने हैं just to make sure that you are going in the right direction. Yeah. Yes. तो मेरा first keyword है aortic और पेपर में टाइम कम होगा तो मैं फटाफट पढ़ता हूँ. TAVI, people aortic wall stenosis. TIA can be considered if a previous insertion malfunctions. Second, malfunction. Previous word is also very important. Means I try to gather the keywords कि क्या पता कौन सा कीवर्ड मुझे कहां मिले. थर्ड, मेथड टू एड्रेस स्पेसिफिक वेस्कुलर क्लोजर डिवाइसेस. Approach preferred because it is minimally invasive. Means TAVI must be having different approaches. Which approach is preferred? Issue that can be rectified by antithrombotic therapy. Insertion of the delivery sheath in the apex of the heart. Patients stay in the hospital during the recovery period. So we have got few keywords. Like if I close my eyes now, I can remember apex. I can remember which method is preferred. I can remember wall stenosis. I can remember a couple of few more previous. These are the words which will set into your mind. जितने आपने ज्यादा वर्ड सुने हैं वो आपके दिमाग में बैठ जाएंगे. Now you guys, let me take you up. Now you don't have to do anything. Just read the topic heading. Transcatheter aortic wall implementation. Why it is done. Benefits from TAVI. I'm just reading from the top. What is transcatheter minimally invasive procedure? Why is it done? Aortic wall stenosis word is given. The word we wanted. Who benefits? Okay. Second, multiple ways of delivering TAVI valve to the aortic wall position. Okay. Multiple ways. Which method is preferred? So this I can find transfemoral, transapical, transaortic. Answer should be out of these. So at least the question which had which method is preferred should be answer should be B. I just have to write A, B, C, D in the first 7 questions. Issues, there was a question about issue and antithrombotic therapy. Now I can see it over here. So I have done 2 questions in no time. Then again, I take this. So issues is in the C paragraph. Recovery period and risk of surgery is given in the D paragraph. Okay. So now I again go to questions. TAVI is performed in people with aortic wall stenosis. I'm not quite sure, but it can be in A where I read it, but I'm not sure. TAV can be considered if previous insertion malfunctions. This I could not find. Method to address specific vascular closure devices. Now I would like to check this maybe because it can be in the methods mean it can be B or C. But then when I am going to B, by chance I could see in the C specific vascular devices. Here it is. So that is how you try and find. Means you try to devote less time and out of 7 questions you just have to do 4 questions. तो अभी तक मुझे एक क्वेश्चन मिला है. So I found one question. And one more question was there, which I already found, was the question number 4th, approach preferred. Preferred, which is minimally invasive. So it should be in the B paragraph. I am not wasting my time. So 3rd and 4th question are done. 5th, issue that can be rectified. We have already done C. This is also done. So 3 questions done in no time. Means I am not getting deeper into the details of the paragraph. Is just from the open point of view. Again, reading part A is very important. It has got 20 marks. 20 marks. And we need overall 32 or 30 marks to pass. So you can understand the importance. If you can get 18 marks in the part A, you just need 12 or 14 marks in the part B and C. So A part is very important to be done. Again, strategy 1 to 7 questions first. Okay. I will tell you the importance of it. Insertion of the delivery sheath in the apex of the heart. So I will try to find previous word and apex of the heart if I can find somewhere. Apex of the heart, not here. Heart word is not given. I can see no, aortic wall, no. Aortic wall replacement word is given, but it's not given over here. Heart word is given in the B paragraph, last paragraph, the heart team. And I need apex of the heart. It's not here as well. Can I find somewhere? No. Lung disease. So that is where if I am unable to find the previous word and apex word, now this is the main time where I need to save time. Means now these 2 words are in my memory. If I try to find this word, I'm wasting my time. So I know I have got only 15 minutes. So okay, I'm taking it forward. Okay. Now question number, if I do now question number 7th, patients stay in the hospital during recovery period. Recovery period, oh, that's easy. Risk and recovery period. So I've done 4 questions. Again, 4 to 5 questions will happen in less than 2 minutes or 2 minutes. That's the only way of doing reading part A. In 2 minutes, you have to do 4 or 5 questions. Now, please understand the scenario. Out of the 20 questions, you have done 5 questions or 4 questions, which are right. Now, if you ask me, paragraph 1 gives me the information about TVAI, who benefits from it, why is it done, A paragraph. B paragraph was about 3 different methods. C paragraph was talking about problem, issues, and solutions. Now I remember it. And D paragraph talks about recovery period and risk of surgery. Now let's see the magic. 4 questions done. Now question number 8. How is comparative risk of death by TVI with regard to surgery? Where was the surgery word given? Guys, where was the surgery word given? In the paragraph? I will show you again. Sorry, I'm unable to admit these guys.
D.
Okay. So it was in the D. So now it will save my time because I'm using the same strategy of ABCD. That's why I did first 7 questions. I found 4 questions or 5 questions, which makes me easy that I have done 4 or 5 questions in 2 minutes. And now even when doing 8 question, 9 question, I know where it should be. Surgery. My question is comparative risk of death. I will simply go to the 4th paragraph and will read the word death. Here is the word risk of death is lower than surgery. So comparison, and this is what I teach when I talk about grammar. Comparison means the second degree, higher, lower, ऐसा ही word आएगा. I am better than you. I am worse than you. He is better than you. He is higher than you. Comparison always means word like lower, higher. So this is just the perfect word for me. So how is the comparative risk of death by TBI with regard to surgery? It's lower. So lower should be the answer. What is observed to occur when the heart's aortic valve narrows? Okay, this I'm not quite sure in which paragraph it is. but I will try to find one. Narrow word, because narrow is a very easy word and I should be able to find it somewhere. Narrow word, if I can find somewhere. Uh, 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 Not really. But by chance, I can see the word apex. Can you see this word? Now, apex. So now I will do that question as well. So in the quest of finding, that is why I left those question. So apex word now I can trace. So I will do that third or fourth question, whatever it was. And now my again preference is narrow word. If I can find the word narrow somewhere, not really. And A paragraph is too clumsy, so I will do the paragraph A questions later on anyhow. But I can see narrow word over here on the first line to replace a narrow aortic valves, and in the bracket it is given aortic valve stenosis. So now I will read the question again. Means you just have to follow the technique 1 to 7, 4 to 5 easy questions in 2 minutes. Then you try to understand in which paragraph. So ninth question was tough for me, but narrow word I wanted to find. Which are the conditions that increase the risk of surgical valve replacement? A risk word was given in the which paragraph? D paragraph. So it should be in the D, I guess. In conditions increased, or C paragraph also we're talking about the issues. So it can also be there. I need to find the word surgical valve replacement. That's it. Oh, surgical aortic. So this is given over here. This is the line, right? In the D paragraph. What was the question? Can you read the question for me?
Which are the conditions
The
that
conditions. So conditions are not given over here. I guess no. Condition is not given over here. So I said either C or D. C. Where are the conditions given? No, not really.
A paragraph? A paragraph.
No, it's not given. So A paragraph, again, I'm not getting into the deeper details of A, but yeah, I will keep on checking because if 3, 4 questions like this will come, conditions. See, it is given right in the centers. Some questions are easy to find because they are just very, very visible to every eye. So I can see it over here. Lung disease or the kidney disease are the conditions. That is what we need in part A. Obviously, it requires a lot of practice, but I can tell you the strategy. 1 to 7 questions, only easy questions. So if you are unable, like I could not find the word narrow, I left it. I could not find the word apex in the first turn, I left it. And that is how you keep on doing. At least you want to do 13 to 14 questions in your first shot, and that should take around 10 minutes. Now, next question. When is TVI delivered by an incision on the left side of the chest? We were talking about the apex. Left side of the chest should also be in the same kind of a paragraph. So I will again go to paragraph B and will try to find left chest of the this. And also I could read it somewhere in the B paragraph. I'm not quite sure. Left side of the heart is given somewhere in the B paragraph.
Yes.
Where about?
It's in a second point. Second point.
Trans. Sorry, I can't see it otherwise, but it should be in the B or C.
Left side
Second
of the
point.
chest, the
Okay.
nipple line.
Transapical. Okay. 5 to 10 centimeter. Again, see, some words, obviously, I'm not finding just because of the computer thing, but some words are given right in the middle. And आप कभी भी अपनी eyes की skimming और scanning करोगे ना, तो जो middle में words होते हैं वो दिखते हैं. जो लास्ट में छुपे होते हैं राइट लेफ्ट में वो मुश्किल से दिखते हैं. तभी पेपर भी हमेशा बैलेंस्ड होता है. जो एग्जाम बनाने वाला क्वेश्चन पेपर क्रिएटर है, द क्रिएटर ऑफ द क्वेश्चन पेपर always have few easy questions which are right in the center. So on the left side of the chest, so I will take this. And now what was the question? Which method? No, question number 9 or 10. When TVI,
Delivered by an incision on the left side of the chest.
so when we need the direct access to the heart. Come on, that should be the answer, no? What's the question?
Transpical.
When is TVI delivered an incision on the left side? This can be this answer as well. I'm not quite sure whether we should write transapical or we should write a 5 horizontally made on the chest which provides direct access to the heart. So I would have been the creator of the question paper. The answer should have been when we require the direct access to the heart. That should be the right answer. Or transapical, then we cannot write so many words. So that's why they would have changed it to transapical. But direct access to the heart should be the right answer as per me. Okay. So transapical we are writing because we cannot write more than 3 words. Okay, guys. So again, I have told you the strategy, but yeah, let's which condition limits the effectiveness of transfemoral approach? Now I know it is in the B paragraph. Which risk is involved when a leak around the TVIL risk should be either in the C or should be in the D. Otherwise, it's a tough question if it is in the A. So I will do question A afterwards because that is a big paragraph in the exam final exam. There won't be a big paragraph like the paragraph A over here. But still, I'm saying I'm doing easy things first. Only easy question first to save my time. So this question, it should be in COD. Which risk? Is it in the COD generally asking? Which risk when a leak occur? Leak word I want to know. डी ना. सो अब ढूंढ लेते हैं. अब आपने मेरे से मेहनत करवाई है तो मैं ढूंढ ही लेता हूँ लीक वर्ड कहाँ पे दिया है. There are number of other specific, including a leak around TBI. So now basically I know where these questions are. That is why I did not leave 1 to 7 questions because I can figure out it should be in the D or C. My mind is still working in the same zone. So I am saving time in every question I am doing. कि ये D में हो सकता है ये C में. So I don't have to go through the complete reading for every question. So I'm more strategically planned, and that is what saves time. So now I will read the question again just to do the question for you. Which risk is involved when a leak occurs around the TVI? That should be in the bracket wala na? And a paravalvular regurgitation. So that is how you do it. Simple. Then once you follow the strategy, it will look like a simple. What risk is increased on the administration of TVI? Administration of TVI, it should be either in the B paragraph where they were talking about 3 approaches, maybe. Otherwise, it should be in the A paragraph. Risk word is given in the D paragraph now. Which risk is increased? So I need the word. Oh, why shouldn't I check the paragraph D? Which risk is increased? Risk of stroke. Where is
Yes.
it given? Third line, the risk of stroke is slightly higher in TBI. Now,
Yeah.
should not be like that. Which risk is increased? Increased word should be there. Risk of stroke, but it's a tough one then. Means, no, it's a tough one. It's not easy to find. But risk word is given only in this thing, so we have to take it from here only. So stroke might come as the reason, but risk of death is lower. Achha, the only risk that increases is stroke. Now, please understand, they were asking which risk is increased. If you read the line, I will read the whole lines for you. TBI is generally reserved for the patients who are at the risk. This is because it is a better medical therapy. Risk of death is lower. So only one risk is increasing. What is the risk? Risk of stroke. So that is how they have reached to this. So not an easy question, but at least we know the location. So that is what you can do. You can leave this question. Maybe you can do it in the second round, but this question should be done because you know it's an easy one. There are risks involved in TBA as with all word is very important. As with all medical conditions, as with all treatments, क्योंकि TBI is a treatment, है ना, is a kind of a treatment. There are risks involved in TBI as with all. It should be given in A or D. A has more chances because it is kind of an introduction, and I just have to find the word all. Narrow word I have again seen in the first line. Narrow word. So I can again get that word. I still remember what I have left. But in all word is given somewhere. All word is very important. It must be mentioned. No, but it must be there. Then we have to do it's a minimal invasive. In all procedures, word can come then. But again, I can't waste time. Sorry, I'm moving on. If I will get stuck, you will also get stuck. We will leave this question, we will do it later. Otherwise, we will look as with all medical procedures. This is what I will fit in. If I cannot find anything, so obviously this is an automatic blank. There are risks involved in TVA as with all procedures. It's an invasive, minimally invasive procedures. So I can say as with all medical procedures. Addressing wall thrombosis can be done by evaluating the role of, it should be in the C. It should be in the C.
Yes.
Wall thrombosis. This is given over here. This one. Am I right?
Anticoagulants.
This one. So a paragraph is all about skimming and scanning. Anything that you are unable to skim and scan and you start reading the paragraph, man, you are going in the wrong direction. Because you don't have time in reading part A. And reading part A, if by chance becomes stronger, you will fetch 18 marks for sure. And by chance, if you can fetch 19 or 20, that's even better. But if you can get 18 marks, that means it relieves the whole burden of part B and C. So practicing this part A is real thing, means it's very important. Now going on to question number 17 or maybe 17. A dash is expected within 2 months of procedure. A dash is expected. Means if I do any procedure, so a recovery is a dash is expected. Obviously, we can expect a recovery. This is medical mind that you need to be aware at that. But I will again, A word articles are very important. Even in the task, it should be with the word A. So I will go with 2 months. 2 months is an easy word to trace. D part.
Yes.
Okay, I'm sorry, I was thinking about A. Okay. 2 months. Yeah, I can see this word 2 months. A full recovery. But if it comes in the final exam, I promise you, if they have given a word, a so-called A, in your question, 100% that would be given in the paragraph because these are the hints of the articles. It would surely be there. But over here, it's not given. But 2 months is easy to find. So you have to look out for those questions first, in which, like 2 months, it's very, very visible to eyes, everyone's eyes. So this is my easy question. I will not leave it for the second turn. Okay. Now, second, third, or last questions. Dash is addressed by the trials comparing different TVIs. It should be in the B paragraph
Yes.
because they're making comparison. Na? There are three different things. ट्रायल्स वर्ड ढूंढते हैं चलो ट्रायल्स वर्ड ढूंढते हैं इट शुड बी इन द सॉरी इट शुड बी इन द बी पैराग्राफ अदरवाइज बट या ट्रायल्स oh trial word wall thrombosis but now randomized trials
Uh, Approach. The heart team will
random
access.
trials word is given multiple times if you will see I will underline how many times it's given this 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 and maybe this okay now I want to know the question kya tha what's the question
Assessment of the approach for delivering TV.
comparing different TVI devices. So I can find the whole keywords over here in the set. So what is addressed? Passive voice was given. Is MR third form is a passive voice. जब हम letter लिखते हैं, we write so you are requested to. You are requested mean is MR third form. You are requested by me. You are requested by us. So is MR third form is as good as a passive voice as was were third form is. Physiotherapy was given. In the same way, we never say physiotherapy is given because in letter we write today the physiotherapy has been given. ये present perfect है. What is the difference between is given? Please इस वीडियो को अच्छे से देखना again. मतलब ऐसा नहीं होता ना कि मैं सिर्फ अब आपको रीडिंग पढ़ाऊं मेरे दिमाग में बहुत कुछ चल रहा है. इज एम आर थर्ड फॉर्म का मतलब क्या होता है? आई गो आई डू माई होमवर्क. My homework is done by me. It is present indefinite. I daily do my homework. My homework is done by me. अगर मैंने कल होमवर्क किया था आई डिड माई होमवर्क माई होमवर्क वॉज डन बाई मी पैसिव वॉइस फिजियोथेरेपी वॉज गिवन 3 days अगो पेशेंट वॉज एडमिटेड ये हम लिखते हैं पैराग्राफिंग में जब टुडे विजिट होती है तो मैं कहता हूं टुडे आई डू माई होमवर्क डी टुडे आई हैव डन माई होमवर्क सो इसका पैसिव वॉइस बनता है टुडे माई होमवर्क हैज बीन डन बाय मी इसीलिए हम लेटर में लिखते हैं टुडे द पेशेंट हैज बीन एडमिटेड पेशेंट हैज बीन फाउंड विद हम इज फाउंड नहीं लिखते टुडे द पेशेंट हैज बीन डायग्नोज्ड विद so that is why this passive voice of present perfect so today always come with present perfect ठीक है इज एम आर थर्ड फॉर्म मीन्स ये ऐसे किया जाता है तभी तो हम कहते हैं अगर आप ध्यान से सोचो दिस प्रोसेस इज कॉल्ड फोटोसिंथेसिस दिस प्रोसेस इज कॉल्ड दिस क्योंकि हमेशा ऐसे ही कहा जाता है इट्स प्रेजेंट इंडेफिनिट So is MR third form is present indefinite, was were third form is past indefinite, and has been third form is present perfect. Today this has been done, this has. Okay, राइटिंग का भी कंसेप्ट क्लियर हुआ थोड़ा सा? एवरीबडी ओके
Yes, sir.
प्लीज? नो सर? ओके,
Yes, sir.
आई एम जस्ट किडिंग. Okay, the last one is a dash determines the best treatment options for each individual. So it should be either given in the A paragraph last or in the B. है ना, A का लास्ट भी कुछ है who. A paragraph last देखो अब now why did I choose A in this, है ना? A dash determine the best for each individual. Each individual means is a living being, and my mind says who word comes for the living beings. So a dash determines the best option. Now I have to go for the best word in the A paragraph last. Where is the best word given? Most appropriate treatment. First paragraph. First paragraph only. फर्स्ट पैराग्राफ का भी फर्स्ट पैराग्राफ. ओके, तो बेस्ट वर्ड कहां पे दिया है? Okay. Now again, the last concept which I would love to teach you when we are doing reading. Again, there are many concepts, but yeah, these are important concepts which happen in every reading. A article, but in this reading it's not applicable. But वैसे otherwise in the final exam अगर a word दिया है तो पैराग्राफ में भी मिलेगा पक्का. ऑल वर्ड दिया है तो पैराग्राफ में भी मिलेगा पक्का. इन द सेम वे एक और मैंने आपको एक इंपॉर्टेंट चीज बताई थी अभी, इफ यू रिमेंबर आई वॉज टीचिंग यू अबाउट कंपेरेटिव डिग्री. सो देर आर 3 डिग्रीज, प्लीज ध्यान से सुनना. देर आर 3 डिग्रीज, लिखने की जरूरत नहीं, हमें आती है. गुड, बेटर, बेस्ट, लो, लोअर, लोएस्ट, हाई, हायर, हाईएस्ट. अब रूल ऑफ इंग्लिश क्या है आपकी रीडिंग पार्ट बी के लिए भी काम आएगा ये. रूल सीख लेते हैं पहले. सेकेंड डिग्री इज ऑलवेज अ कंपैरिजन डिग्री. अगेन ये हम बात कर चुके हैं. आई एम बेटर देन यू, यू आर बेटर देन मी, आई एम वर्स देन यू, यू आर, मतलब इट्स ऑलवेज अ कंपैरिजन. लोअर, हायर, ग्रेटर. Even when we talk about speeds, you know, he's better in speed, all those things. Third degree is known as superlative degree, the best, the most. अगर अगर क्वेश्चन में द बेस्ट है तो पैराग्राफ में भी द बेस्ट या द मोस्ट, द हाईएस्ट ऐसा वर्ड जरूर होगा, तभी वो लाइन मैच करेगी. ये तो इसमें तो आसान हो गया कि बेस्ट का बेस्ट है. कई बार फाइनल पेपर में इस वाली लाइन में आंसर निकल सकता है जहां पे मोस्ट वर्ड दिया है. ये कौन सी डिग्री है? मच, मोर, कंपैरिजन. ही इज हैविंग मोर देन यू, कंपैरिजन. और कंपैरिजन डिग्री हमेशा देन वर्ड के साथ आती है, THAN के साथ. ये कंपैरिजन डिग्री का सबसे बड़ा इजी फाइंड आउट होता है. नाउ इन दिस मोस्ट वर्ड और जो सुपरलेटिव डिग्री होती है वो हमेशा दा के साथ आती है. इट्स अ रूल. सो द बेस्ट, द मोस्ट, द हाईएस्ट, तो जैसा वहां पे दिया है वैसा ही. So you have to understand these things so that reading part A, B, and C can become easy for you, because that is how you can trace. Sometimes you will not find the exact word, but you will find these degrees helping you, comparisons helping you, and you would be able to solve your question paper. Now, if it would have been your final exam, a paragraph would have been little smaller. लेकिन आप पेपर को पूरा कर पाते लगभग 10 मिनट्स में. आप लगभग 14-15 क्वेश्चंस कर लेते. मुश्किल 5 या 6 क्वेश्चन आप छोड़ते जो आप अब करोगे. जैसे कि अगर मेरे को अब मेरे पास बाय चांस टाइम ना हो फाइनल पेपर में और मुझे ये करना है फर्स्ट क्वेश्चन, टीवीआई इज परफॉर्म्ड इन पीपल, तो मैं ए ही करूंगा क्योंकि हम इंडिविजुअल की बात भी कर रहे थे, पीपल की बात भी कर रहे थे, सब ए में ही था. टीवीआई कैन बी कंसिडर्ड इफ प्रीवियस इंसर्शन माल फंक्शंस, आइदर ए और सी, क्योंकि सी में भी कुछ इश्यूज दिए थे. तो मैं सी भी कर सकता हूं पेपर में. एक क्वेश्चन मेरे को गलत, मेरे को पता होगा पेपर में, सो आई वोंट टेक मच टेस्ट. बट प्रीवियस वर्ड को मैं एक बार और कोशिश करूंगा ढूंढने की. और माल फंक्शन वर्ड भी बड़ा साफ है तो मैं पहले ए में ढूंढने की कोशिश करूंगा. मॉल फंक्शन वो वर्ड दिए कुछ नहीं दिए. मॉल फंक्शन दिया हुआ है यार, मॉल फंक्शन शुड बी वेरी क्लियरली. और पीपल वर्ड ये रहा, इफ बट इज नॉट फंक्शनिंग वेरी वेल, ये दिया ना। जो फंक्शन अच्छे से नहीं कर रहा वही तो मोल फंक्शन है। नो, नहीं, मॉल फंक्शनिंग का मतलब ये होता है ना जो अच्छे से काम नहीं कर रहा। तो फिर ठीक है, ए कर देते हैं इसको भी, और खत्म करते हैं अपने इस पार्ट को 1 to 7 को। फिर उसके बाद जो बचे हैं मैं बाकी क्वेश्चंस को टारगेट करूंगा जो जो मैंने छोड़े हैं। जैसे अब नैरोज वर्ड, व्हाट इज ऑब्जर्व टू अकर व्हेन हार्ट्स आयोटिक वॉल्व नैरोज। अब मुझे कहीं और नहीं मिल रहा तो मैं फर्स्ट लाइन से पकड़ लेता हूँ कि हार्ट वॉल्व नैरो होती है, तो उसको ब्रैकेट में लिखा हुआ है आयोटिक वॉल्व स्टेनोसिस कहते हैं, तो मैं ये लिख दूंगा। So that is how I will go about my reading. Means I will not create panic in the initial stages. I will try to do 4 to 5 questions of 1 to 7. Then I will go to 8 with the same thinking कि ये बी में है, ये सी में है। अगेन मैं आपको दोबारा याद कराता हूँ आइस बंद करके। फर्स्ट पैराग्राफ इज अबाउट इंट्रोडक्शन, who benefits, why is it done, a paragraph over. B paragraph is about three different things, three different approaches. Third paragraph is about issues and its solutions, and last paragraph is about risk and recovery. So that is how you will remember the headings by heart, and that is how your problem will be solved of reading part A. And again, if reading part A is strong, chances are the highest that you will pass. Again, this is Dr. Bhupesh from Dr. BKM Institutes. Thank you very much.